This DVD has been put together by members of the Facial Pain Physiotherapy team at University College London Hospital's NHS Foundation Trust. It is intended to be used in conjunction with advice given to you by members of the Facial Pain Management team. While stretching, it is helpful to remember to move to the point where you feel first signs of tension or an increase in tension and hold the stretch at this point. You do not need to feel pain to benefit from stretching. Hold each stretch for at least 15 seconds and take comfortable, relaxed breaths throughout each stretch. If you notice that you're grimacing, grunting, tensing of the muscles or holding your breath while stretching, try to reduce the size of the stretch. Tensing during stretch is often a sign that you're moving further than it is helpful to. The first movement is pursing your lips. Move your lips as far as you feel comfortable to and hold this stretch as you gently breathe in and out. Try to remain relaxed in the rest of your face as you hold this stretch. The second movement is making a smile. The smile can be as large or small as feels comfortable for you. It doesn't matter how large this movement is. It matters that you're moving in a range that doesn't lead to increased pain. The next movement is a frown. First, make a frown only using the muscles around your mouth, turning the corners of your mouth down. Continue breathing comfortably and try to keep the rest of your face relaxed. Now create a frown using the muscles in your forehead as well as around your eyes. Check in with your shoulders, arms and hands as you hold this stretch. Are you still relaxed and breathing comfortably? First, try to move your bottom jaw forward of your top jaw. This movement's not very big. You may not be able to see a lot of movement, but you may feel your bottom teeth resting slightly in front of your top teeth. Hold this stretch at a comfortable point. Then move in the opposite direction, trying to move your bottom jaw back, increasing the gap between your top and bottom teeth. Again, this is a small movement. Move only as far as it's comfortable to. Next, move your lower jaw towards one side. Try to move your jaw as well as your lips. Again, this movement is not very large. Hold at the point of first tension and keep breathing. Now, slowly move to the opposite side. You may find it easier or harder to move to this side. Just move as far as you're confident to. Continue to take relaxed breaths. Next, smoothly open the jaw as wide as it feels comfortable to, without moving beyond the point of tension. Try to remain relaxed in the rest of your face and your shoulders while you hold this stretch. The next movement is similar, but includes bringing your tongue to the roof of your mouth as you relax the jaw open. Rest the tip of the tongue on the roof of the mouth as you hold this stretch, just moving to the point you're comfortable to. Stretch the tongue towards the back of the roof of your mouth, focusing on moving the tongue rather than opening the jaw wide. Try to relax the muscles in the rest of your face and neck as you stretch the tongue towards the roof of the mouth. Now stretch the tongue out of the mouth, moving the tongue towards the chin. Hold your mouth in whatever position feels most comfortable for you. Try to breathe while holding the stretch. Bend your head forwards to the point of a comfortable stretch, letting your chin move towards your chest. Check in with the muscles in your face as you hold the stretch. Is your face still relaxed? Now move slowly in the opposite direction, tilting the head backwards. Sarah can move a long way into this stretch. It's not necessary to move this far to get benefit. Just move to the point that you feel comfortable. Next, bring your right ear towards your right shoulder, trying to keep the shoulders relaxed as you move to the point of a comfortable stretch. If you notice that the muscles in your face have become more tense, make the stretch a little smaller. Move your head slowly now to the left and bring your left ear towards your shoulder. This stretch may feel easier or harder to complete than the previous stretch, so just move as far as you're comfortable to. For the next movement, turn your head towards the right. As you find the point of a comfortable stretch, hold the movement and monitor if tension has increased in your arms, hands or face. If it has, make the stretch a little smaller. Now move smoothly to the left, completing the same stretch towards this side. Remember that your range of movement might be different on the left to the right. This is very normal. Just move to the point of a comfortable stretch on this side. Move both arms towards the ceiling, holding at the point of a comfortable stretch. It does not matter how high you can raise your arms or if you raise one arm further than the other. Just move in your comfortable range. Now stretch the right hand down the side of the right leg, leaning your body towards the right. Stop at the point of a comfortable stretch. At this point you should still feel relaxed and able to breathe comfortably. Next, move to the left and complete the same movement on this side. Check in with the muscles in your face, arms and hands. Are you still relaxed as you hold this stretch? If tension has increased, make the stretch smaller. Moving back to the right, raise your left arm to a manageable point over your head as you arch your body towards the right. This is a difficult movement, so you may not be able to bend as far as you could in the previous stretch. Repeat the same movement to the left. If it's difficult to hold your arm above your head as you stretch, you can rest your hand on your head. If it's hard to breathe comfortably, make this movement a little smaller. Now turn your body and head towards the left. This movement stretches a lot of the body, including the back and neck. Hold the stretch at the point that you feel first tension. Now turn smoothly to the right, moving to the point of first tension. Notice if you're still able to breathe into the bottom of the lungs as you hold this stretch. If it's difficult to take relaxed breaths, make the movement a little smaller. The following set of exercises are designed to help to increase the strength of muscles around the jaw. Most people maintain adequate strength in the muscles of their face through activities such as talking and eating. Many people with facial pain do not have particularly weak muscles. They have tight, tense and painful muscles. We would recommend that you regularly complete the stretching exercises prior to beginning strengthening movements. If you then think that you would benefit from completing strengthening exercises, gradually introduce these exercises along with activity including talking and chewing. If you have any questions regarding the potential benefit of strengthening exercises, please contact your facial pain physiotherapist to discuss this further. open your mouth comfortably and keep your mouth open while you apply an upward force to the bottom of your chin with your fingers. The muscles around the jaw are working to keep the mouth open against the upward force of your hands. Continue to breathe as you hold the movement. Next, open your mouth and apply a downward force to the top of your chin as you attempt to close your mouth. Again, your mouth will not move, but the muscles will be working against the force of your hands pushing down as you attempt to close the mouth. Now move your lower jaw to the left and attempt to hold it there as you push towards the centre with your left hand. The muscles are working to keep the jaw to the left as the pressure from your hand attempts to move the jaw back to the centre. Continue breathing and try to stay relaxed. Smoothly move the jaw back to the centre and over to the right. Use the right hands to push against the jaw, attempting to move it back to the centre while you use the muscles around the jaw to resist this movement. Try to keep the rest of your face relaxed and continue breathing.